talked, if you're at our meeting last year, we spent a lot of time on it, but because nutrition and colic really tie in together, I thought I'd hit some key points that we can discuss tonight. So colic, what is it? It's abdominal pain in the horse. Basically, it means their GI tract is bothering them in one way or the other, and they're uncomfortable. Unfortunately, because as Dr. Keene referred to, the design of the GI tract maybe wasn't well thought of. It's one of the #1 causes of illness and unfortunately death in the horse. Any horse, regardless of age, breed, or use, is susceptible to colic. And so, again, back to the GI tract. As Dr. Keene mentioned, there's a lot to it in a horse, from the mouth to the rear. There's a lot going on. Basically, from the stomach, we have our small intestine, and that filters into this big guy here. This is the large colon. The large colon, as we talked about in the cecum is basically the equivalent of our appendix in the horse, or a dog's appendix. But it's huge, and these two structures are really important as far as how the horse digests feed, and we talked about that earlier. But there's a lot of real estate within the GI tract that can go haywire, and that's why these guys are so prone to problems. And one other thing to keep an eye on, or to keep in mind, is that within the abdomen of the horse, all these components, especially this big colon here, they're really not anchored down very well. In other words, they're free to kind of move around, and as material, gas, feed, liquid is being digested and pushed through the GI tract, that causes that GI tract, or that colon in this case, to also move around. And so if we have a horse that develops gas in their colon, which every horse does, it can be like a beach ball in the bathtub effect. That buoyancy can cause it to move around, and it can sometimes get itself in trouble. It can get into a spot where it creates discomfort, or worse yet, it causes compromise to, say, blood circulation, or just the overall health and function of the gut. So there's lots of possibilities, and so colic's a pretty broad term. Think abdominal pain. It doesn't mean that every time your horse colics, it's going to be the same time or the same problem every time. It can be a whole host of issues. Sorry, there we go. So what are some symptoms of colic? It can vary, and depending on the horse, how maybe stoic they are, their breed, they can present a lot of different symptoms. For example, a young quarter horse may not be able to handle discomfort very well, and it may be quite obvious when they're colicking. They're very agitated, irritated. But a draft horse or a mule may be completely different. They may not show any of these common signs, and so it can be very challenging to know. But luckily, you guys, as the horse owners, oftentimes will pick up on subtle things that are different with your horse that may not be obvious to someone who's not around their horse every day. Yeah.
I have a question for you. So I've been told if a horse is stoic, you can't solve with colic, or move down the roll, they get up in shape, not colic. They get up in no shape, colic. Is there any truth to that?
Depends. Certainly horses will lay down, they'll get up in shape, but that doesn't mean that all is right.
Right.
I wouldn't necessarily.
I mean, if you're expecting colic, if you see them lay down roll, they get up in shape.
Yep.
So like they're fine if they shake, but if they don't shake.
I'd be just cautious with it, using it as a general thought. Again, it just depends on the horse, and any of those symptoms I just showed may or may not be present. And so the #1 thing to think about is your horse not right. ADR, we call it, ain't doing right. Is he not eating like he should? Is he a little bit quieter or dull? not, you walk into the stall, is he to himself, or is he looking at you? Is he nickering? Is he talking to other horses? All those things could be a role.
So if you suspect something's wrong when you start to roll, is there any validity to that?
No. Yeah. But I wouldn't necessarily walk away from the horse either. It'd be a reason to maybe keep a closer eye, maybe see if it's repeatable, maybe see if some of those other symptoms start to show. Here's an example of a horse that's agitated, showing some mild signs of colic. I won't identify whose horse this is. So again, this horse, he's not laying down or rolling, but he's also tied up. But look what he's doing. He's stretched out. He's looking back at his flank. He's obviously not happy. Now he's kicking at his belly. He's pawing. Those are all things that, sometimes a horse tied up will do, or sometimes a horse in a stall is going to paw the ground. But, adding it all up, and this horse definitely seems disturbed. This horse definitely is not happy with what's going on. And in my opinion, colic would be the number one problem until proven otherwise. In other words, I would suspect his gut's hurting somewhere, and that's what's causing the pain. And that's what I'd want to investigate before ruling anything else out. So if you suspect your horse is showing any of those signs or discomfort, what are some things you should do? Well, first off, again, what are those things that you're seeing? That's going to be helpful when you're talking to a veterinarian. If the horse is in a location where if he lays down and rolls, he may get casted or caught up under a fence or run, move him to another location. If he's, 20 below outside in the winter, he's out in the pasture, uncomfortable, can you bring him inside or into a kind of a more controlled area where we don't have to complicate the picture with him getting caught up or cut or beat up in one way or the other? Is he near an irrigation ditch? Maybe get him away from there. Transportation options. This is important, especially once you call your veterinarian and call your vet. And the reason I would say that is there's a lot of things to discuss. And so if you can have some information, describe what you're seeing with your horse, he's laying down, he's lifting his upper lip, he's agitated, he's sweating, those can be relayed to your veterinarian on the phone and decide kind of what the urgency is or how serious it may be, how long it's been going on, what's the age, breed, and sex of the horse. That can be relevant because sometimes certain causes of colic are more common in certain horses, say a mare that just foaled in the last month compared to a 6-year-old gelding. So that's good information to share. Has a horse had a history of colic? For me, that's really important. If I'm talking to someone and their horse has had a history of colic, sometimes that information can be relevant when deciding what to do with that horse and where to go as far as treatment. Location of the horse and transportation. Can this horse come to a vet clinic? Is this horse at your property, or is the horse out in the middle of a pasture? That's important so that we know what kind of environment we have to work on that horse or assess that horse. Has the horse received any medications? And if so, what were they? And finally, is surgery an option? And I always usually bring that up with the client because surgery is a big deal in horses, abdominal surgery or colic surgery. If any of you guys ever been through that with your horse, you know that one, it's a very expensive situation, but it's also a very invasive procedure that can really affect that horse moving forward. However, sometimes that's the only option. And if it is an option for the horse, Maybe that horse would be better suited to go to a surgery center. Doesn't mean that horse needs surgery right off the bat, but at least that horse is in a location where it can be attended to if it needs to. And so I usually have that discussion with the owner, simply because, one, we don't offer that service at Red Lodge Vet Clinic. There are a couple places within the state that do. And so if it comes down to making that decision, we want to do what's right for the horse. So what can your veterinarian do? Sorry about the screen here, guys. Well, and I get this a lot, like, are you just going to give them Banamine if you come out? And we'll talk about that later. But there's a lot of things we can do. First off is trying to figure out what's going on. I think of the abdomen in the horse as kind of like a black box. We're trying to figure out where in that GI tract the problem is and how serious it might be. Is this something that the horse should be able to resolve and get through, or is it something that's going to require more heroics, maybe even surgery? In some cases, a thorough exam can identify whether that horse needs surgery or not, if that's an option, and that can be helpful as far as making a decision in a timely manner. So anything from ultrasound to a rectal exam to blood work can help us make that determination. And then treatment, a whole host of things. Obviously, we want to make that horse comfortable. And so if we can't keep a horse comfortable and they're showing symptoms of colic and that persists, we have to do something different. And unfortunately, sometimes that decision comes down to surgery, which isn't an option for every owner or every horse, or euthanasia. Luckily, that's not as common, or the frequency of those severe forms of colic are not as common as the milder forms of colic that tend to resolve on their own or with just a little bit of assistance on our end. But it really boils down to, can we keep that horse comfortable? And that's where a lot of times at a clinic, we have a better chance of doing that than in the backyard or in your pasture in February in the middle of the night. And so with colic, regardless of what's going on, when that horse is uncomfortable, time is of the essence. And sometimes we know when this horse started to get uncomfortable, the owner witnessed it from the start. Other times, hey, I got home from work and I noticed my horse was down and rolling. He's pretty beat up. How long do you think it's been going on? I don't know. I just got home from work. So it could have been going on for hours or even days. And so we really need to get after it if we want to try to help these horses. So Banamine. This is certainly something that is commonly used. A medication is commonly used to help horses with a wide variety of colic. In general, it's very safe. Most horses tolerate it well. And it certainly can help in a lot of cases. Like I mentioned, the majority of colic episodes that horses exhibit are more on the milder side of severity. That means that maybe they're just going to get better on their own. Maybe they got some gas, or their guts are a little bit upset, and in a matter of hours or less, they're going to be back to their normal self. But I think a lot of people assume that Banamine is generally a cure-all, or they get that false sense of security that Banamine will take care of it. If it doesn't, the horse isn't going to live, or the horse isn't going to do well. That's not always the case. And in some cases, we want to be conservative with our use of Banamine, particularly for that horse that may be a surgery option. If that horse is dealing with a twist in their gut, for example, we're probably not going to be able to fix that, short of going in and doing surgery. Luckily, that's not very common. Banamine may make that horse feel a bit better, but it's only going to be short-lived. And remember, time is of the essence. If that colon or that intestine is twisted on itself, there could be compromise occurring, or basically that gut, that portion of the intestine could be losing some of its health and viability. And there's plenty of situations where a horse goes to surgery, the surgeon opens up the abdomen and finds that a good segment of the gut is already dead or compromised beyond repair. And oftentimes that's a bad news for the horse. And so Banamine, in my opinion, on the really severe cases of colic, it tends to not provide much in the way of benefit, but it can also be a situation where maybe that horse doesn't have a twist. Maybe that colon or that intestine is just in a spot where it's not too happy. Or this time of year, we deal with a lot of, we call them paction colics, which means that the large colon of the horse basically fills up with feed material, and basically the horse becomes constipated. And those horses oftentimes respond well to treatment. We can usually fix those horses without surgery, but they require some attention and usually some things like hydration, fluids to help them out. If we give Banamine and we ignore the situation, or you as the owner gives Banamine and ignores the situation, that could drag on, and then that could lead to a harder problem or a bigger problem to resolve. It could lead to what was a milder form of colic becoming a more serious form of colic. That being said, I still think Banamine's a good medication to have, and I think realistically for horse owners, it's appropriate to have it available at all times. And from my standpoint, if I have an owner call, their horse is colicking, they gave that horse Banamine, and yet the horse continues to be uncomfortable, I'm definitely more concerned. Where if they haven't given it, depending on what they're describing, you as the owner that is, and how severe the horse may be, we might be able to, discuss about monitoring it at home for a little while, or staying in touch, or looking for, less intensive ways of dealing with it at the time. So it is worth having, but be careful. It's not the perfect solution, and it's definitely not going to solve all your horse's problems. So some risk factors for colic, for horses that can cause colic. Listed a number of them up here, but really it boils down to stress. I think every one of these, one way or the other, is going to lead to stress. And the horses, like we talked about, nutrition, are creatures of habit. And if things get disrupted with their normal routine, whether it's their feed intake, their water intake, that's going to potentially lead to problems with their gut. And that can lead to discomfort and colic. And sometimes that stress is invoked by us. It could be a long trailer ride. It could be competition on a hot day. It could be, poor feed that we provided. So diet can directly affect gas production. Horses normally produce gas. We hear it all the time. That colon, that large colon, like I mentioned, it's full of healthy microbes that are breaking down feed. They're producing gas. But if there's a problem with that gut, it can produce more gas, or maybe that gas that's being produced can't escape. The horse doesn't fart, and it causes that horse to basically get bloated. So feed can directly cause that. Motility, or basically the passage of feed from mouth to butt, can be slowed down, or in some cases stopped altogether. That's a bad deal for the horse. Usually they're uncomfortable, and that's going to affect how well they can get through that episode. Motility can also be increased. We call it spasmodic colic. That's like me after La Panitas tonight. That grumbling kind of deal. So, but sometimes the gut's just hyperactive, and that's creating discomfort to the horse, cramping sort of pain. Manure volume, Sometimes feed itself, whether a horse is on a high grain diet versus a high forage diet, may affect how much manure output they're producing. And the rest of these are pretty straightforward, but remember the health of the microbes, those guys in the colon, those bacteria that help break down hay and grass. If they get upset and they're not happy, they're gonna start creating problems for the horse, and that can lead to not only colic but other health issues as well. And nutrition is the direct effect on that. So examples of diets that can lead to colic. Can you guys think of any horse that's not on any of these? Maybe grains, or fats. But is there one thing on here that no horse receives? Yeah. True. Yeah. But all horses get forages or grasses. I mean, everything on here is typically a component, one or multiple, of the horse's diet. And so the point I'm getting is, yes, greens can be a problem. So can forages, mature grasses versus lush grasses, poor quality feeds. These are things that we all encounter with our horses all the time. And so we can sometimes improve on that. Sometimes we can. And that's where maybe analyzing the hay, like Dr. Keene mentioned, or choosing when to turn your horse out on pasture, or how quickly you make feed changes can be helpful in trying to prevent any of these factors from becoming a problem. Well, one, the PowerPoint thing did that. I couldn't quite name it. But two, I really think that grains are like a red flag there, honestly. Yeah, exactly. So we're talking about, like, again, oats, high energy carbohydrates. And not to say that you shouldn't ever feed those, or those can become or shouldn't be required for all horses, but a lot of horses don't need high amounts of grains, or really any grains at all, in my opinion. The ones that do are usually performance horses. They're working horses. They're race horses. Their demands are a lot higher than our ranch horses, our pleasure riding horses. And so for the thoroughbred that's receiving 5 gallons of oats, or 5-gallon bucket of oats after it races, versus the pasture pet that receives that, they're going to process it different. They're going to handle it different. And that racehorse is probably going to be fine, but that pasture horse that got into the feed bin and ate all that grain, that's going to create some havoc with the gut. I just want to bring this up, and this has just been kind of my take on things, and then we'll wrap it up on my end here. But I think weather plays a big factor in causing GI disturbances in horses. And you know, I think around here, this time of year is when I typically see the highest incidence of colic in horses. And I think the reason for that is that we're in the first storm or two of the season. The temperatures are dropping. For horses that haven't been, say, on hay diets consistently, they've been still relying on grazing and forage, and now they're going on to dry matter hay. It can really affect how they process that material. And I think that what is fairly common in my experience is that when there's drastic weather changes, from warm to cold or vice versa, it can really disrupt how that horse takes in feed and water. And when, you know, I bring up, this is our weather forecast for the next 10 days, and we got like a high pressure system coming in, and it's really fairly consistent. And that's not too bad, but when we see these like Chinook effects where we have maybe a period of really cool weather and then it warms up to 40 or 50 degrees, or there's extremes from daytime high to lows are quite extreme. I think that can really affect how these horses handle stress, how they handle themselves as far as nutrition and hydration. And so probably the most common type of colic that at least I see this time of year is the impaction colic. It's that horse that's eating a lot of dry hay, and never mind the quality of the hay. We've already kind of beat that one to death. But the point is that they are consuming a large volume of dry matter. Their colon has to eat that or has to process that. And if they aren't consuming enough water, things are going to start to dry out. And then stress, as we know it, can sometimes lead to changes in motility, changes in gas production. All those things can come into play. And so impaction colics or gas colics are fairly common this time of year. Go ahead.
So when it's cold out and your horse has been 24-hour turn, how do you encourage them to drink more water when they don't have salt available? How do you encourage them to drink more water when it's not warm or how to coach that?
I don't think there is a best way, you know. And so sometimes it's the factors you have to play with, you know, like I'll talk to people about maybe considering like mash feedings, maybe consider electrolytes added to their feed. They don't have salt, they should have salt, but maybe they need salt in their grain versus that salt block that never gets touched.
Would you do a wet grain? So like, yeah, mash, but would you do a wet grain?
Yeah. So I think like a pelleted complete feed, like an equine senior feed, soaking that in water can help. Yeah, exactly. Yep. And I appreciate that, you know, that's not always really practical for everybody. You know, in a stable setting, that might be achievable consistently. But, you know, feeding a wet mash to a horse on the ground in February, they better eat quick, you know.
How much water are you adding to grain?
I don't think there's a ratio. I'm just trying, usually about 10 minutes at least, but I'll sometimes let it sit overnight too. But just to soften up that feed. And again, like I mentioned on the last talk with water intake, I mean, there's so many variables that influence how a horse is going to, or how much water they're going to consume or not. And we have very little control over that. And so the take home from this is, you know, if there's going to be some predicted weather disturbances coming up or changes, I would think about one, if nothing more, checking on that horse a little bit closer. Because maybe it's a mild colic or maybe it's not a big deal, but if you don't check, you don't know. And then two, if there are some things like salt or electrolytes or mashes that you can provide, that might be an option that time. You're not going to be able to prevent everything, but again, I think those weather disturbances are just another form of stress. And we know that taking a drastic change in diet is also hard on the horse and their gut. But factors like this can also be a consideration.
How much extra salt would you put into their feed if they're not able to have access to a block or a free salt during feeding when the weather changes? Would you add an extra?
I usually tell people like 2 tablespoons. Okay. Yeah. So it's not a lot, and it can be just your light salt, salt from your pantry. There's electrolytes, you know, summer games, commercial electrolytes that you can use, but I think the poor man's electrolytes is salt. So I think, yeah, go ahead. Yep.
So if you feel that a horse is colic until the bedtime or whatever, keeping them moving is that recommended preventing it from going down, obviously?
Yeah, that's a good question. I get that a lot. Should I walk my horse while I'm waiting for the vet, or when I'm trying to see if the horse is going to get over this. And again, it depends. My feeling on it is if the horse is really agitated, they're trying to lay down or roll or hurt themselves. Number one, get them into a spot where if they do that, they're not going to get hurt or in a bad situation. So if you had like an arena, I'd bring them into the arena. If you had a pretty, like a box stall, maybe that's the best spot versus outside on the hill or something like that. But as far as walking goes, I think in general, you're not really going to change the situation by activity. And think about all that. If you have a belly upset, you got to go to the toilet. You probably don't want to be moving around too much. You're not feeling very good. And so I think asking for exercise is not always the right thing to do. If that horse is quiet, they're laying down, but they're not rolling, they're agitated, but they're not thrashing themselves on the ground, I wouldn't really try to encourage that horse to do much of anything. Again, make sure they're in a safe spot, but I'd be, again, trying to communicate with the vet or figuring out transport options. But like I say, if that horse is in a bad spot, or you just cannot keep them from up and down rolling, sometimes activity is the best thing you can do before the vet gets there. No, keeping them moving. Keeping them moving. So. There's one type of colic we call it a left dorsal displacement, where the colon is kind of pushed over to one side of the abdomen. And, I used to do it, but rarely do I do it anymore. But there's an option where you can try to anesthetize those horses and roll them over in a certain way to try to fix that problem. But in my experience, it's a Hail Mary. Like, if it's ever worked, I can't remember. So to me, if a horse lays down and rolls, the chances of them making it worse are probably the same. Like, I think the chances of them twisting their gut just by rolling are probably pretty low. Versus, like I talked about, that buoyancy effect, that beach ball in the bathtub situation, like that's going to cause that colon to move around more so than if that horse is rolling. And so I don't encourage rolling. If they're really uncomfortable, we don't want that. And again, those horses tend to get beat up. They get sores on their face, on their back, and certainly they can get caught up in something or hurt more. And again, if a horse is doing that, as the owner, I would get that horse moving. I'd be walking that horse, and I'd definitely be making plans to get that horse seen by a vet, because that's obviously a more serious form of pain. But if that horse is quiet and he wants to lay down and just kind of sulk there in the stall or in the corner, I'm okay with that. Again, think about you. If you have a bellyache, sometimes you just need to sit there and let it hopefully pass. So, yeah. Yeah.
What if they do want to eat, which is not common, but what if they do want to eat?
It kind of depends on the type of colic, and that's where, as a general rule, I would say don't encourage that. They could just be adding fuel to the fire, so to speak. But if I've assessed the horse and I know what's going on, well, again, if I feel confident I know what's going on with the horse from a medical standpoint, there may be certain situations where I might actually offer food and with the hope that maybe it kind of maintains some GI motility. But without knowing anything, I would say your best is just cut off feed. Water, I wouldn't remove, but feed, yes. So, any other questions? Yeah.
And then they tested his urine, and he had 4 and 9 gut ulcers. So we did the same where the ulcers are. That day they gave him electrolytes, CSF,
then probably 3 weeks later, he acted the same way, took it back in, thought he maybe had gas colic, but during that time, I was doing the NASH and doing all that. But now, I mean, I think he's better now. He's still on senior. I've been giving him senior feed, forage, and he's been turned out on the pasture. But the manure is just like a cow pie. It's never gotten back to normal horse manure.
Yeah.
Is that big? Can I help that somehow, or and he
Yeah.
Okay.
Okay.
I mean,
Well, I mean, it's certainly good that at least things are kind of moving through,
he
but
drinks a lot of water.
yeah.
And he urinates a lot.
Okay.
So,
So, like we mentioned, I mean, some of that could be diet related, and you know, probably the solution would be diet in one way or the other. But some of these horses, if they've had enough insult to the gut, like there's been enough inflammation or irritation over time, maybe it's from an infection, or maybe it's from toxins building up in their bloodstream, or something else has caused enough damage to the gut itself, it may not absorb nutrients the way it should. And some of these horses can actually lose water, lose protein, because we call it kind of a leaky gut. Basically means that the health of the intestine to absorb nutrients and excrete waste is not doing its job. And, you know, I can appreciate that's kind of a tricky one to diagnose sometimes. And with the history of ulcers and sand, that could very well be tied into that as well. So, not saying I have the answer to what's going on with your horse. There could be a number of possibilities, but yeah, like the hind gut ulcer is definitely suspicious to me. And hopefully it's something that, yeah, certainly there's treatments for that, but hopefully diet can be somehow critiqued in a way to improve that over time. Dr. Keene, do you have anything?
Sand. You know, sand, I don't have anything, but, you know, sand does not leave in a month. If it builds up, you got it.
How many days do you treat for ulcers? So how long do you know for 3 weeks? Okay. So 20 is what they say. Give them on that. I had a similar issue. I have my daughter's barrel horse just calling constantly, so we finally went for full treatment in 20 days. She has caused the same, but she could also have loose stools as well. So I just said I would not do that. So she bought that.
Yeah. So yeah, the horse that colics frequently or continuously, those are challenges and troubling cases for owners and vets. And ulcers in the stomach and or the colon are a common reason for that, but there can be other factors at play. And again, I think that, you know, if nothing more, tonight, think about what you're feeding and if it can be improved on, or maybe it's a discussion you have with your veterinarian to decide if there's things that you can do different, because every horse is going to require different ways of management. And something like your horse, you know, it may be a situation that can't be totally rectified, but you might be able to manage your horse better through certain dietary options. Well, there's some thought that, like, especially like stomach ulcers, higher alfalfa hay will lead to kind of a buffering effect to the gut. So that acid that Dr. Keene was talking about is produced. It's a low pH, and alfalfa diets can sometimes raise that pH, so it's not so acidic, and that may lessen the chances of ulcers, but it may not be that simple. Any other questions, you guys? Yeah. And thanks for coming, everybody. Yeah. Go ahead. So the question here was, what would be a diet regimen for a 30-plus-year-old horse?
Casey, sorry, I want to know that
Yeah.
too.
Yeah, I'll get up here. The question was, what would be the diet regimen for a 30-plus-year-old horse? So, again, I say depends.